Hello, everybody. Thanks again for joining Hype. I've got Dr. Turner here. He is actually a expert and a friend, and I wanted to share with you some of the things that he has to say about regenerative medicine and where healthcare is today. And he's got some interesting information about something called exosomes that I thought everybody'd like to hear. So, Dr. Turner, what is an exosome and how does it differ from the buzzword stem cells that I've been hearing?
Well, thanks for having me, Jeff. I'm definitely not an expert, but well versed in what I've learned from uh, doing this for quite some time now. But exosomes differ from stem cells. They're being described as kind of like the secret sauce of stem cells. Exosomes cannot replicate, they cannot transform into malignant cells or the harmful cell types. They are less likely to trigger an immunologic or immunogenic response. They cannot be infected with a virus. Where stem cells, on the other hand, can replicate and become that cell of that certain tissue.
Interesting. So, how do these stem cells actually work?
Uh, sure. Exosomes are extracellular vesicles. They're those small bubbles that are released from cells that act as shuttles for genetic information, proteins, and even messenger RNA to other cells. This usually happens in response to injuries. Generally speaking, exosomes carry healthy and lost information in certain target cells. Exosomes released by young stem cells have shown to be very powerful in regulating regenerative processes in the body and assisting in rejuvenation. Exosomes from stem cells contain valuable cell information consisting of proteins and that genetic information the cell needs to function correctly. These stem cell derived exosomes have also shown to assist in transferring what's called NK cells or killer cells into T regulator cells or helper cells. By that, they assist in calming an overreactive immune system and modulating it to respond in a coordinated fashion. They can also be as a delivery system for medication.
So, are these drugs or are these natural? Where do they get these exosomes?
Yes, they are natural components of the body. They are sourced. Actually, we get them from a laboratory grade GMP certified mesenchymal stem cell. Several accepted techniques, such as differential ultracentrifugation, which is multiple times in a centrifuge to for the different gradients in finding the density in precipitation, filtration, and the size exclusion, they have been applied for exosome separation. Our exosomes are extracted using that ultracentrifugation technique.
Excellent. So, tell me a little bit about. I know that you've been doing therapies for a long time and you've seen lots of regenerative therapy patients. Tell me what conditions you've seen work with regenerative therapy and what the future holds.
Yeah. Well, at the clinic, we've got doctors that address this with the patient themselves in a consultation, an exam, and they they know exactly how to evaluate that person and what is good for them. And through this, exosome therapy is a minimally invasive procedure commonly used in orthopedic injuries and for anti-aging and other degenerative diseases. Exosome therapy can be injected into the affected area, like in an orthopedic injury, or given intravenously for the anti-aging and even hair loss. Need to do a little bit more. Um, these exosome therapies are either delivered by intravenous infusion, which is basically like an IV. That's a intravenous injection for chronic or systemic full body conditions, or interarticular for joint conditions. And that's what we mainly focus on is the joint conditions, but it can be used for an array of conditions. And it's we're not treating the actual condition itself or saying that that's what we're doing. We're merely going after the signs and symptoms that that disease presents, and helping to decrease that through the exosome therapy is our ultimate goal, to where the condition itself, hopefully over time, dissipates. Like patients with Lyme disease, chronic inflammation, immune disease, and other chronic degenerative diseases may benefit from including exosomes into their treatment regime. We aren't, again, diagnosing you or with your condition, but it's just administering the exosomes to help your body with your condition.
So, how safe are these for your patients? And
Um, well, the starting material in the mesenchymal stem cells are GMP laboratory grade, meaning that they have been screened for disease, viruses, and bacteria. Once the exosomes have been extracted, the stem cells are discarded. The finished exosome solution is sterile, filtered, and tested according to the standard pharmacological regulations for sterility.
excellent. So, let's talk about risks. Have you seen any risks in all the folks that you've helped?
It's extremely unlikely, as there are no immune markers on the surface of exosomes. They are not cells or tissues. It may be possible to experience die-off reaction after receiving exosomes, as they activate the natural killer cells to become regulator cells. For this reason, we always give a small test dose before applying a larger dose.
Excellent. So, how many times does someone need to receive a therapy?
Well, based on the doctor that performs this on you, some cases a follow-up treatment may be advised. There's no sustainable data about standard dosing and the treatment in an individual as the response. Some patients may need a single application, while others may need multiple doses or a smaller booster therapy. In some cases, therapy may start with a small initial dose, which is increased over time. Every person heals at different rates, and it's about finding what works for them and giving them the most necessary to help override their condition.
Excellent. So, how fast have you seen patients tell you they've had results?
Well, the exosomes, they trigger a so-called biphasic response. So first, in the immediate reaction, this is usually they last about 24 hours until the initial proteins have broken down. Then the messenger RNA, which has been inserted into the target cells, becomes active and helps reprogram the cell. This usually takes about 6 to 8 weeks. So the timeline is about 8 to 10 weeks. The continued effects may continue for months afterwards.
What are the things that people should make sure they tell their doctor so there's no negative effects or contraindications that you professionals call it?
Sure. Yeah, the contraindications for exosome therapy. Exosome therapy is usually performed on an outpatient basis. So most patients should expect to leave the clinic without any downtime. The patient will not experience any discomfort. Less than 10% of patients have reported developing a mild fever, headache, nausea, or vomiting. However, these side effects have never lasted more than 3 days and usually resolve within 24 hours, and that's less than 10%. Um, we haven't experienced that at our clinic, but it is something that could happen, and just want to always make sure people are aware of that. But there's no long-term negative side effects that have been reported.
So, how long is it until I can get back to resuming my normal activities?
Um, well, when it comes to a joint-related problem, you always want to be careful in not aggravating the condition by getting the interarticular injection and then putting the stress that normally would aggravate it, um, and continue doing that. If you want to get optimal response from the exosome therapy, we recommend usually refraining from the anti-inflammatory medication, because the inflammation is what we want the exosomes to seek out. And like stem cells, they are attracted to inflammation, and anti-inflammatory medication can interfere with the optimal response of the exosome, as in the case with stem cells as well. Um, if you can't reduce that because of the condition is so extreme and it you can't get through the day without taking it, that's okay. It's still going to do what it needs to do. It just may take a little longer. We also recommend no over strenuous activity for the first 24 to 48 hours. You can resume cardio workouts usually after 3 to 4 weeks. And after 4 weeks, resume any weightlifting and running activity that's part of your normal routine.
Excellent. So FDA, that's a big buzzword that everybody wants to know. Is it FDA approved? Tell me the answer to that one.
Um, yeah, the FDA, they're regulating and monitoring stem cell therapy. They're regulating and monitoring exosome therapy, but currently there is no FDA approval. And I know people they seek that, and which is great because it's definitely more of a peace of mind. But if you think you go to you go to your local Walmart or CVS and you get your vitamins or minerals off the shelf, those are not FDA approved either. But that's because the FDA has so much that they're doing right now. Once they get to this, and they will, we're hoping that they do, because then it will be a covered entity eventually under insurance, and that will be cost effective for a lot of patients.
Excellent, excellent. So, with that being said, I think there's a ton more of information that we're going to get from Dr. Turner here over the next few weeks. We're going to have him back. So, if you've got questions, go check out hype.com for extended content, and we will see you next week. Thank you so much, Dr. Turner.
Thank you.